Hello and welcome to Fiberman. Now, if you know me, you'll know that I have fibromyalgia. I don't get it as bad as some people get it, but I do get it. I do manage, though, to uh, maintain some level of normality with medication. Currently, I'm taking duloxetine, occasional painkillers, and naproxen, for inflammation and what have you. And that pretty much keeps me in check. Lets me function as a human being. But when I read things that are rather, how to put it, disturbing, it does kind of make me worry somewhat about future prognosis of being somebody with fibromyalgia and how it affects me, but also how it affects other people, because we all seem to suffer with fibromyalgia at either different rates or different parts of the body that seem to be affected more than others. Or, the list goes on, and it can be deeply frustrating. It really can. Hey, while you're here, please boot the old like button. Now, I come across this article, which I have read before, but, it's kind of dismissed it somewhat. But I think it's actually quite important to understand the potential risks so we could at least mitigate them. To be aware of uh, the causes of either depression or the fact we might have more accidents, to be aware of it so we can actually do something about it. Well, in this flipping article here is which is the BMJ group. Yeah, there you go. And they've just they published this article a few months ago now, but it is still relevant, clearly. So fibromyalgia is linked to a heightened risk of death. Now that sounds pretty finite, doesn't it? And fatal, and yeah, that's what death is, I suppose. This is from accidents, infections, especially suicide. Pool data analysis suggests regular physical and mental health monitoring is warranted to minimise these risks. Will that be down to your doctor to make sure that or some mental health professional to make sure that you have some kind of people keep a check on you, really. I would say make sure you've got someone in your family that you can talk to. For me, it'd be my dear wife. I'm quite lucky like that. She's a good woman. She really is. Kind person. And she has her own problems as well. So we kind of look after each other in that respect. But fibromyalgia is a condition that causes persistent, widespread pain and fatigue. We know that, don't we? If you're a fibromyalgia sufferer, you know that. That's the thing you're having to challenge and deal with every single day. And well, there's been small analysis and what have you, and pooled data analysis of the available evidence published in the open access journal RMD Open. Now, the findings have prompted researchers to call for regular monitoring of patients' physical and mental health to minimise their risks. I would say we need someone to talk to, personally. That'd be my main thing, especially men. Men are the worst. We are the worst. Us blokes are terrible for talking about our problems. Now, we're a lot more comfortable doing it with somebody we don't know, to be absolutely honest with you. But if you are in a relationship, you should know everything about each other anyway, shouldn't you? Be open and honest, how you're feeling, Now, a friend of ours is currently struggling with mental health in the family. They haven't got fibromyalgia, but they're struggling. And, in this case, it's the husband. And he finds, he's not having his job and there's lots of pressure and stuff like that. And he's struggling to keep everything in check. Now, you can imagine being that way inclined anyway, and then you've got fibromyalgia to deal with as well, but it's enough to tip you over the edge, isn't it? It really is. And for people who haven't got fibromyalgia or never, or people who like dismiss it as being one of them kind of, oh yeah, so it's like a catch-all, excuse me, it's like a catch-all for every single minor ailment in the book, but no, it's not. It's to do with your pain receptors in the body and the vagus nerve, and it's just, well, basically is not recording that information correctly. Now, currently, as they say here, it's not clear what causes fibromyalgia, but that's not the point of this video. Now, if I scroll down a little bit here, there's been some analysis that show that fibromyalgia was associated with 27% heightened risk of death from all causes over time. So, all causes. So, you're more likely to you know, die from, say, for instance, cancers and stuff like that if you've got fibromyalgia by 27%. It just cancers across the board, and depression and so, although this wasn't true for those diagnosed by the 1990 criteria. But the diagnostic criteria for fibromyalgia have evolved since 1990 in tandem with increasing understanding of the array of clinical symptoms associated with the condition. And they were consequently revised in 2010, 2011, and 2016, and point out the researchers. Now, specifically, the analysis showed that the risk of death from cancer was 12% lower in the general population, people without fibromyalgia, and of population of the same age, and only marginally higher people with fibromyalgia for accidents. Now, I know I stumble sometimes, and I'm not that good on my feet anyway. And since I have fibromyalgia, it's almost like I'm assuming that there's going to be a problem in the knee or something. Not joint pain, but just in the muscles around it. Now, the heightened risk is due to the fibromyalgia itself or the concomitant. Concomitant? I can't say that. Conditions isn't clear. And note that the researchers, as their research wasn't designed to evaluate this, but this is an important issue, and they emphasise which further research needs to address. And they caution their findings should be interpreted in the light of differing designs and a number of participants in the studies included in their analysis. Now, they noticed that there was definite heightened risk. So due to significant heterogeneity across the studies, which were also small in number, no clear conclusions can be drawn from the available data. Now, they do write, however, that it's possible that for all subgroup patients diagnosed by the 1990 criteria, there is no increased risk for mortality, and those diagnosed later versions, the risk is increased. And they are plausible explanations for their findings. They suggest that the finding of increased mortality associated with accidents can stem from fatigue. I would say so. Sometimes I just stumble anyway. Or my leg gives way or something stupid. Now, unrefreshing sleep. Yeah, that's me. That's flipping what? I'm tired now. It's 1:45. I can't get to sleep sometimes. I really struggle. So what I do is I end up going to bed so blooming late just so I can get to sleep. You know, it's like sleep apnea. It's apnea. It's not very helpful. No. So unrefreshing sleep and the concentration difficulties with accompanying fibromyalgia. A couple of sleep, I need some. And are a component of its diagnostic criteria since 2010. And more evidence supports immune system involvement and inflammation in fibromyalgia pathophysiology, which can explain the finding of increased mortality from infections. Physical comorbidity may be an additional explanation. And the reduced risk of cancer death may be due to these patients' extensive use of health services, they suggest. So people basically, go to the doctors more. You might be having problems that get found because of it, because of regular visits. So it goes on. So fibromyalgia is often called an imaginary condition. That's kind of what I was pointing out earlier, where people seem to think, oh, you're just making it up. It's an odd one, but no, it's definitely not that. So there are connections here where people struggle. They struggle, on a daily basis, just to get on, just to get through life and deal with stuff. Now, like I say, my fibromyalgia isn't too bad at the moment, and I seem to be able to manage it anyway. But it is bad. I say I can't sleep very well, so I suffer sleep apnea, sleep apnea, and aches and pains, and the fact you've got to take drugs is not great for side effects, mate. It's just, it's an ongoing battle. And I do suffer with my brain fog. I really do. Like, for instance, you know what the word is, but you just can't put the letters together. I just can't say it sometimes. And I struggle with it. And I get worse as time goes on. I really do. So I think the thing for me would be is to be aware of this stuff, so you could actually do something about it, or you know, note the signals, the things that make you realise that things aren't that great. You know, depression, for instance. You know, what are the triggers? What are the things that set you off, that make you feel depressed? You know, anxiety and what have you. And I get these feelings sometimes when I just overwhelming feeling of anxiety, and it's not easy. It's not easy to deal with sometimes. It really isn't. And so many people out there suffer with not just fibromyalgia but depression anyway. You need some help, and if you can't get it firsthand, as in with family, people that you can talk to, you need to get someone that's not connected to the family that you can talk to. Will be your doctor, or or mental health professional, someone that can actually help you through it, because you don't want to find yourself suffering in silence. You really don't. It's no, you need to talk. It's good to talk, Doodle do.